Breastfeeding is meant to be a nurturing and bonding experience between a mother and her baby, but for many new moms, pain can make it stressful and overwhelming. The good news is that breastfeeding should not hurt, and with the right techniques and support, it can become comfortable and enjoyable. One of the most common causes of painful breastfeeding is an improper latch. A deep, correct latch allows your baby to draw milk effectively without causing nipple pain. Make sure your baby's mouth covers more of the areola, not just the nipple. The baby's lips should be flanged outward, the chin should touch the breast, and you should hear rhythmic swallowing rather than clicking sounds. Positioning also plays a major role in pain-free breastfeeding. Bring your baby to your breast, not your breast to your baby. Keep your baby's body aligned, ear, shoulder, and hip in a straight line. Popular positions such as the cradle hold, football hold, and side-lying position can help reduce strain and discomfort when done correctly. If you experience sore or cracked nipples, take care of them early. Apply a few drops of expressed breast milk to your nipples after feeding and allow them to air dry. Using medical-grade lanolin or nipple cream can help promote healing. Avoid harsh soaps and frequent washing, as these can dry out sensitive skin. Breast engorgement can also lead to pain during breastfeeding. To ease engorgement, feed your baby frequently, avoid long gaps between feeds, and gently massage your breasts before and during feeding. Warm compresses before feeding can help milk flow, while cold compresses after feeding can reduce swelling. Another important tip is to listen to your body. Mild tenderness in the early days is normal, but sharp, burning, or persistent pain is not. Conditions like blocked milk ducts, mastitis, or thrush can cause significant discomfort and should be addressed promptly with professional guidance. Staying relaxed during feeds is essential. Stress and tension can interfere with milk letdown and increase discomfort. Take deep breaths, find a comfortable chair, and use pillows to support your arms and back. Finally, never hesitate to seek help. A lactation consultant can identify latch or positioning issues and provide personalized solutions. Breastfeeding is a learned skill for both mother and baby, and with patience and expert tips, it can become a pain-free and rewarding journey. Remember, you deserve comfort, confidence, and support while nourishing your baby.